Hi, I'm Mackenzie. I'm going to be your nurse today. I just wanted to go over a couple medications with you. I see here that you're going to be taking heparin while you're at home. So have you ever used heparin before? No? Okay. Heparin is an anticoagulant. It's a blood thinner, so it's used to prevent the formation of blood clots. You are going to be using this at home, and it is going to be given to you, you're going to be doing self-injections. So when you're giving yourself an injection, you want to make sure that the area of skin, you want to do it on like a fatty prominence, kind of maybe on the belly or the thigh, like the inner thigh. When you are giving yourself the injection, you want to make sure that the area is nice and clean with alcohol, and then you want to take the plunger and inject the needle into your skin at a 90-degree angle with the skin pinched. Make sure you pinch it. Inject the plunger and then pull it out, and then I would hold a little bit of pressure or wipe the area off after you have already injected the medication. And because it is a blood thinner, you want to make sure that you are watching for signs in that area for bleeding, like any unusual bruising, and then make sure you're changing up your areas, and you want to take it at the same time every single day, okay? You do not need regards when it comes to this medication, like regards for meals, I'm sorry. So you can do it at the same time every day, but it doesn't have to be taken with a meal. And then, like I said, you want to watch for other signs of bleeding, like shortness of breath, dizziness, sweating, any anxiety, severe stomach or back pains. And then you're also at an even more increased risk for bleeding if you're taking aspirin, other antiplatelets, or other anticoagulants. So you just want to make sure that you're watching for those signs. And you will be having surgery here in a few days, in 3 days actually. So 2 days before your surgery starts, or 24 hours before your surgery starts, you want to stop taking the medication, just so that way your body can begin to thicken the blood a little bit more prior to surgery, because you don't want to be on blood thinners when you go into surgery, because you're at an increased risk for even more bleeding during that surgery. Okay, do you have any questions for me?